Up until now, if you live in the city of Seattle and want to get rid of unwanted prescription drugs, there wasn't a free option within the city. But that's all changing.
Today I'm signing Council Resolution 31654, expressing the city's support for an effective, safe, countywide prescription drug disposal program.
Seattle Mayor Ed Murray recently signed a council resolution to urge both pharmacies and the Seattle Police Department to install prescription drug disposal boxes.
King County Public Health will install the new prescription drug drop-off locations across the city, helping reduce opiate drugs in our homes that often lead to addiction and abuse, which is a crisis in the city as it is across the country.
City Councilmember Lorena Gonzalez is one of the local leaders who's been working hard to make it easier for people in Seattle to safely get rid of unwanted meds in an easy and non-intimidating way.
There will be no questions asked, and it's completely anonymous, and there should be no fear about criminal prosecution if folks take advantage of either the pharmacy option or the police precinct option.
The rollout is expected to happen this summer. 5 precincts of the Seattle Police Department have been asked to install the drop boxes. In addition to the police departments, the city is also asking all pharmacies to participate by allowing a drop box to be installed by the health department.
It is at no cost to pharmacies who participate voluntarily in the program. Those costs will be covered by Seattle King County Public Health, and those boxes will be maintained, and pickup will be completed by the agency, and it will be done sort of consistent with what the DEA expects of us to do with controlled substances.
One reason for the big push for the rollout is due to the growing heroin crisis in our community.
Oh man, I'm fine. Well, let us know if you need anything, okay?
More people in King County now enter detox for heroin than they do alcohol, and the number of opiate-related deaths has tripled since 2009. In 2014, there were 156 heroin-related deaths in King County, the highest number in 20 years. Leaders with Public Health, Seattle and King County, say 80% of people who abuse heroin first get started by abusing prescription drugs.
More people now die from drug overdoses than die in car crashes, both here locally and nationally. So it's a tremendous problem. It's touched families throughout the country. Many of us here know people who are either addicted or have overdosed on prescription drug medications or heroin.
Dr. Duchin also says while safe disposal is important, so is safe storage, because people who are truly addicted will look for it when they're in your home.
About 12% of our high school students say they've used prescription drug medications to get high. That's a large number, more than 1 in 10. And the majority of them say it's easy to get prescription pain medications from the medicine cabinet of family, friends, and acquaintances.
Aside from keeping prescription meds out of the hands of people who might abuse them, there is also a huge environmental impact when people don't safely get rid of their meds. Flushing them down the toilet means sending them out to Puget Sound.
Our sewage treatment plants do a really poor job of removing toxics from the waste stream. So if we can keep it out of that waste stream altogether, that is obviously a good way to go.
A recent study by the National Oceanic and Atmospheric Administration's Northwest Fisheries Science Center found an alarming concoction of drugs, both prescription and illegal, in juvenile salmon and sculpin in Puget Sound.
This is important habitat. This is part of Puget Sound right here. And
Chris Wilkie is the executive director of the Puget Soundkeeper Alliance and wants to take a closer look at how dangerous drugs are getting into aquatic life in Puget Sound.
I think it's important. I think they really should do a study and try and figure out what percentage of these drugs are being directly flushed versus passing through our bodies. If it's what's passing through our bodies, then the take-back programs won't help that much at all. If it is the biggest problem is people flushing down the toilet, well then we can address that with source control, and it costs next to nothing to implement compared to sewage treatment.
And while offering free places for people to take their unwanted prescription drugs is only one piece of a complicated puzzle of both preventing environmental damage and preventing addiction, it is an important piece that could make a difference in keeping the Emerald City greener and safer.
Watch CityStream Thursday nights at 7 on the Seattle Channel, or get video on demand and podcast anytime at seattlechannel.org.